fall, everyone. I'm Nate Madden, Policy Impact Strategist on the policy team at Health Forward, who focuses on our state level work in Kansas and Missouri.
And I'm Rob Gibson, also a Policy Impact Strategist, and I focus on our local work in Kansas and Missouri.
We're doing something a little different, and we wanted to give you an update outside of the legislative session on both state and local policy happenings.
That's right, Nate. And there's a lot happening on the local level since local policy continues all year round, during and after the state legislative sessions. Consequently, our goal is to make sure you are up to date on local and state policy on a consistent basis. I'll pass it to Nate to kick off this policy update.
Thanks, Rob. Let's take a look at what's happening policy-wise where Health Forward is working. First up in Kansas, we had some great news after the regular session gavelled out in late April. Reimbursement rates for community health workers through Medicaid were more than double after Health Forward and partner organizations continued to advocate for increased rates. There is still more work to be done, mainly to help organizations with community health workers submit their claims successfully, but this is a major step forward. Also, while nothing is official yet, we're hearing that there will be an interim committee on affordable housing on November 20th and 21st. Interim committees are important as they preview a little about what will be prioritized in the legislature next year and gives a chance for advocates to get involved early.
On a local level in Kansas, in Johnson County, the Kansas Housing Advocacy Network, CAN, led by United Community Services of Johnson County, UCS, will be hosting a virtual training on October 16th entitled Taking the Next Step, Connecting with Decision Makers. If you are interested in attending, utilize the links below to register and access their website for other valuable resources. Recently, Thrive Allen County hired Pimpo Moya to assist with their advocacy work on the local and state levels. Thrive is a key service provider and convener in Allen County that supports and encourages programs, policies, and resources that promote access to healthcare, healthy lifestyles, and positive community conversations for all residents of Allen County. Continuing with Iola, the Iola School Board voted to extend an agreement with development firm BNIM, allowing more time to secure funding through historic and low-income housing tax credits from the state of Kansas. This funding and the tax credits will be used to convert 3 former elementary schools into housing, which will help address the need for affordable housing in Allen County. Lastly, in July, the 9 members of the Wyandotte County Board of Commissioners voted unanimously to not raise property taxes for next year. This means the unified government will operate with a revenue-neutral budget for the 2024-25 fiscal year. The Kansas Black Leadership Council, KBLC, has hosted a series of brunches across the state to inspire civic engagement, gather community champions, and celebrate achievements. For example, on August 24th, they convened in Wyandotte County to engage with residents on advocacy and policy issues at a local and state level.
Moving over to Missouri, we've been watching what's been happening with the public health emergency unwinding and how it's impacting Medicaid. Last year, we supported a campaign to help people maintain their coverage by re-enrolling. Despite this, there are still about 236,000 fewer people with coverage now than in June 2023, with 80% of those people disenrolled because of processing and paperwork issues, not because they were ineligible. Over the summer, Governor Parson signed SB 895 and HB 2062, which place a ban on eviction moratoria at the local level. We testified against these bills as they take a key tool away from communities to do what's best in the face of a crisis, such as with COVID. Finally, we're eagerly anticipating the December 1st bill pre-filing deadline. This means that legislation is submitted prior to the start of the session on January 8th, so we get a sneak peek of what people are working on. We'll use these to help inform our conversations with legislators before session starts.
Moving on locally, in Missouri, the Kansas City, Missouri City Council passed a local ordinance that prohibits acts that interfere with election workers performing their official duties. As we enter the thick of this election season, this is an important and welcomed piece of legislation. Additionally, the Jackson County legislature approved an ordinance that will help create a senior services fund for older adults. This fund will be supported by a property tax levy that would take 5 cents for every $100 assessed in value for real and personal property. Jackson County residents will have the opportunity to vote on the Jackson County Seniors Count Ordinance during the upcoming November election ballot. Earlier this year, Cass Community Health Foundation broke ground on the new site of their Safety Net Dental Clinic. The new site will increase capacity to treat youth in Cass County and allow for eventual expansion of services to adult family members of children currently being treated. Lastly, on November 5th, Lexington residents will host a special election to determine the three-way race for mayor. This is the first time in the city's history there will be 3 candidates on the ballot for mayor. As you can see, there are exciting things happening in Kansas and Missouri on the state and local level. Back to you, Nate.
Thanks so much, Rob. And it's good to see all the action on the local level. We know that a lot of what happens locally can have impacts on the state level as well. We really appreciate you joining in for this out of session update. We want you to see what we see, and please reach out to us if something pops up on the horizon. Let's partner up for health, power, and strong communities.
Yes, agreed, Nate. In coming videos, we will continue to provide useful information that will help you and others in our community live inclusive, powerful, and healthy lives. See you next time.